Good afternoon. My name is Nguyen. I'm the clinical lead for public and population health here at Google Health. Unfortunately, I'm not able to sort of present on screen with my face and the images showing, but I will try my best to sort of make this as interactive as possible. Let me get the slides up now and sort of proceed with the presentation. So the name of my presentation today is Using Technology to Improve Population Health. And so first, thank you everybody for inviting me to participate and inviting Google to participate in the first Asia Pacific Social Prescribing Conference. We really appreciate this opportunity and acknowledge that we're all sort of beginning to learn about what population health means in the broader context. But we do believe there's some opportunities to bring technology to bear to really help the space advance in a meaningful way. And as I previously mentioned, I'm Nguyen. I'm the clinical lead of public and population health. I'm actually both a physician and epidemiologist and spent a fair amount of time at the Centers for Disease Control and Prevention before joining Google here. So let me move on to my next slide and sort of begin this presentation. First of all, what is Google Health? When you think about Google Health, it's really a company-wide effort to really help billions of people live healthier lives. When you think about Google, we've been around for a little while, but our first foray into health happened in about 2008, about 14 years ago, where we had a personal health record put together. And since then, we've been building out health capabilities to really support users in different ways. What we learned, however, was that during the COVID pandemic, there was a real need for information around health. And then subsequently, we found that Google had a pretty significant role to play in health, public health, population health. People came to Google searching for answers around COVID and what was COVID? What do I do about COVID? Where can I get a vaccine? And in that context, we recognized that there was an opportunity for Google to play a much larger role in the healthcare space. And in that context, really making efforts to sort of support billions of people. When we think about Google Health, we're sort of thinking about sort of how we actually bring to bear technology to help consumers in a meaningful way, how we also bring data together to inform policymakers and public health officials, and lastly, how we bring together sort of some of our cutting edge artificial intelligence work to really sort of move the needle in terms of technology and what can be done with technology in health. When you think about our approach, we really think about health in three ways. We call them the three C's. We think about consumers, we think about caregivers, and we think about the community context. When you think about consumers, Google at its core is a consumer-based company. And you think about many of their products, whether it be Google Search or YouTube or Android, they're really made for consumers to utilize every day. And what these tools do is they provide information or they act as tools to really help people make decisions in their everyday moments, especially along their healthcare journey. A second area where we're beginning to think about health is really thinking about caregivers, whether that be a nurse, whether that be a physician, or whether it be a community health worker, someone in the community working with patients, and really empowering businesses to really bring data to bear and leveraging our artificial intelligence and machine learning expertise to improve health outcomes. The last area where we're focused is this idea of community context. And we clearly recognize that when we think about health, beyond healthcare, much of it happens outside the four walls of a hospital or a clinic or any kind of healthcare setting. It really happens in the community in which people live, work, learn, pray, worship. And it's in this context where we're trying to bring tools to government entities as well as community stakeholders to really inform decision-making, bringing that data to bear to really help make decisions that are consistent with what's happening on the ground in a real-time fashion. So let me move on to the next slide. To talk for next, I'll spend some time talking about consumers and some of our consumer products and how we believe they can actually inform population health as well as informing sort of some ideas around social prescribing. So first, when we think about the consumer, for all of us, many of us have encountered the healthcare system in different ways. And there's this healthcare journey or this user journey that takes us from point A to point B. And we like to think about this healthcare journey and or health journey in this 4 steps. First, there's the idea of discovery. So let's say I have a daughter who's 11 years old, and let's say there's a fever. So the question is, what does she have? And she might have a rash along with it. So I might go to Google search to sort of understand and look up pictures of rashes and ask, what are the common causes of fever in an 11-year-old? Or I actually, let's say, slightly different situation. I'm sort of getting a interesting readout from my Fitbit that says, hey, I might have a irregular heartbeat. So some of that data is coming in to share, to sort of tell me that there's something going on with my health. So this discovery phase is this first phase of the consumer journey. The second phase of the consumer journey is really trying to understand what's going on. And we have tools like YouTube to help consumers think about that, about what they can do to improve their health. The next stage is really this idea of helping them to decide. So once I discover what I have and gathering some information, I understand it a bit more, I need to make some decisions. And some of those decisions are what kind of care is available to me. So thinking about this, really thinking about using maps in Google search to find out, is there a physician near me? What services are provided by the physician or caretaker? And then lastly, thinking about putting together a plan and acting on this and using, again, a Google Fitbit or Nest to really help manage the disease or manage a condition. So as we think about this user journey throughout this health user journey, it's really critical for us to sort of, at Google, to think about these 4 steps. And it doesn't apply just at the individual level, but you can actually elevate this at the population level, where populations are thinking about discovering sort of what they have, understanding what they have, just making decisions and acting. It really moving it up to that second level of insights so that policymakers and sort of people who are making decisions for communities can have the information they need to more effectively manage these various user journeys. So when we're thinking about consumers, one of the most important things that we've learned is that information is a determinant of health. So during COVID, we found out that the right information could actually really help people get vaccinated, prevent the next disease. And the wrong information could actually result in death or decisions that resulted in more morbidity or mortality. So in this context, we realized that we had to do our best to get the right information to consumers on our platforms. And what we started with were these 3 sort of ideas: defining what the principles were, understanding what the right partnerships were, and then moving that information into our products. So from a principle perspective, we worked with the National Academy of Medicine and the World Health Organization, who put together these principles about what a trusted source was. Ideas like governments and academic institutions tend to be better at providing validated and trusted sources. These organizations frequently have vetting processes to make sure that information is actually aligns with the best available literature. And then subsequently, making partnerships with some of these organizations, whether it be the Mayo Clinic or Stanford Medicine in the US, or the Mass Brigham or National Academy of Medicine, National Alliance for Mental Illness, finding these right partners who use these principles and have these vetting and who have the best information possible that we can deliver to consumers. And then subsequently, when you think about the products that we have, really highlighting the most authoritative content. So putting that information, in this example, about depression onto a sort of surface, which might be something like a search surface or a YouTube surface, and really highlighting it, letting people know that the source of the information was an authoritative source, such as the Mayo Clinic. But this whole spectrum of really going out there and finding the most credible information is really critical. And it's really critical at a population level too. So as we think about population health in Singapore or around the world, how do we get the best available information to users and to consumers in a meaningful way? A second area, a place where we're thinking about, we've invested in terms of consumers, is really getting information to consumers to help them make decisions. So enabling people to find information and care with less friction. So one of the things we have done here is that in the United States, if you're able to look up a physician and trying to find a physician, you could type in physician near me. And what will happen is 3 physicians will pop up on Google Maps as well as Google Search. And it'll provide some additional information, such as what insurance is taken, in addition to what services that physician may provide. Are there specific language that physician speaks? Is the physician's office wheelchair accessible? But this idea of getting, not just only thinking about information as a determinant of health globally, but helping individual consumers make decisions locally is critically important for us to sort of improve the health of a population. For the next slide, I just want to talk a little bit about Fitbit. And as you know, there are some really interesting collaborations in Singapore with Connected Life and Fitbit going on right now. But as you think about Fitbit, there are a number of things from a consumer perspective that are really critically important. And thinking about how Fitbits can be used to sort of improve, sort of enhance behavior, or in the context of behavioral economics. So, one of the classic things that Fitbit does is it tracks activity. So it helps you become more active. But not only that, it can create a virtual network for you and your friends to join to actually compete on who gets the most steps. So building a virtual community by which you can sort of engage with other members of the community. It might actually help provide data on sleeping and whether the sleeping is important. For you to understand your sleeping patterns. For instance, when I wear my Fitbit at night, it's the first thing I look at in the morning to see if I had a good night's rest or not. There is an option to provide information about meals and enter that information to understand your diet. There's also opportunities to sort of think, stop, and meditate, and sort of help manage stress and anxiety within the Fitbit applications as well. So some tools at the very consumer level that helps consumers in the real world actually sort of manage their health, both on an individual level, but in aggregate at a population level as well. And one thing to consider might be how this might be part of a social prescribing plan. Lastly, I just want to say a little bit about sort of our sort of services around sleep. So we have this new sort of service that's built in the Google Hub called Solely, which is a sort of a mechanism within the Google Hub that allows you to sort of detect movement. It has to be turned on by an individual, so it just doesn't turn on, but the individual has to opt in. But it can actually sort of understand if individuals are sleeping and how well they're sleeping at night with this detection technology. And then subsequently, in the morning when you wake up, that information can be automatically translated into your Google Fit app to give you a sleep score and to give you an understanding of how well you slept at night. But another example of actually moving health outside of the healthcare delivery system into the home, that might be part of a social prescribing plan or a larger population health efforts. Next, I want to talk a little bit about the idea of caregivers and sort of where the opportunities are and what we're doing for caregivers to sort of improve their ability to manage the health of larger populations. So we're partnering with care teams and organizations to build solutions and tools that unlock the potential of data and transform care delivery. And as you know, data is critically important to understanding the health of a population. And these are some of the tools that we're bringing to bear. There's the healthcare the cloud healthcare data engine, the Care Studio, there's their Fitbit Health Solutions, and there's new work around imaging and diagnostics with artificial intelligence. When you think about cloud, it's really critical to have interoperable data systems that are based on HL7 and the FHIR standard to share information and bringing that information together in such a way that is easily inaccessible for healthcare users, both in BigQuery as well as Looker. These two tools that we have to really aggregate information and display them in a way that's easy to understand. In addition to that, we have a tool called Care Studio, which I'll talk a little bit more about as well, which provides sort of all the search features and sort of organization features for data to discover data that you usually find in Google search. But imagine that for healthcare applications for providers, being able to search a patient's medical record, thinking about that medical record over time and getting just the right pieces of information you need, as opposed to a physician like myself spending hours looking through medical records from various visits. Then there's the Fitbit Health Solutions, really delivering health and wellness solutions designed to really increase engagement, thinking about behavioral economics and how you can improve health and drive positive outcomes as a result of that. Lastly, we're doing some really interesting work in imaging and diagnostic artificial intelligence research and using that and thinking about how it might be utilized in the context of screening and preventive measures to really expand the capability of providers to sort of do more screening in shorter time periods. But let me dive into some of these ideas more deeply. So let me talk a little bit about the cloud healthcare data engine. So as you know, we have a cloud product. It's called Google Cloud. And what this is we're deploying with healthcare and life science leaders to really help them make better real-time decisions. And as I mentioned before, data is critically important to managing the health of a population. Looking at sort of the screens on the right here with the green, we're able to produce what's called a longitudinal health record. So imagine sort of a patient who is in the hospital, is in an outpatient primary care, and then goes to specialist care. How do we bring all that information together into longitudinal health record in a meaningful way so that a provider can sit down and see all these data, both on an individual level, but as well as a population level. So you can imagine like a population of heart failure patients, a population of diabetic patients, a population of individuals over 65 or between or under 18, and really understanding sort of the longitudinal health records at an individual and sort of at a population for the level for these individuals, and being able to get that data in near real time, so you can really draw insights in a different way. And so, as you can see on the slide here, you can see how the ability to bring these data together is helping physicians across departments to make better care decisions based on more complete patient histories. And we've partnered with organizations such as the Mayo Clinic to sort of test and build these capabilities. Another product that we're super excited about is something called Care Studio, which is being built and tuned for population health users. So again, this concept that the longitudinal health record is critically important. And as you can see at the screen on the right, many of the physicians who are in the audience, and myself included, have spent hours and hours looking through medical records, trying to understand what's going on with the patient. But imagine if you could get all that information and use sort of the ability of Google tools, search tools, to really pull that information together in a logical fashion, so you can understand the vitals really quickly, so you can understand the fluid balance. The other thing that's really quite interesting about Care Studio is that it can take PDFs and read those and look at that information and process that information with natural language processing and surface that information in the search function. So sort of a step up from what electronic health records can do to really provide clinical insight and support decision making, decreasing that cognitive burden and cognitive load for providers, so that providers are spending less time digging through charts and spending more time thinking about what do I need to do next for this patient or this population of patients that I may have. You know, the next slide really talks about some of the work, really interesting work we're doing with machine learning. I'm not going to go over the whole slide, but let me say a little bit about mammography and radiology, as well as diabetic retinopathy. You know, so as you think of prevention and screening, mammograms are recommended for women to screen for breast cancer. And what we've done is, what we've shown is that if you're able to take a mammography and get a human radiologist to read it, and then also have a machine or using machine learning and computer vision to read it, the results are actually the same. Our ability, our sensitivity and specificity to actually detect disease is on par with a real life radiologist. So you can imagine that in this context, in Singapore as elsewhere, you can actually increase the throughput of reading mammography films in a very meaningful way. So the wait time or whatnot for mammographies might actually be decreased as a result of greater efficiencies. And the same applies for retinopathy. Rather than having to see an ophthalmologist to get your retina looked at, you can actually use a special camera to look into the back of an eye, and then subsequently use machine learning to understand if the person is this diabetic is at risk for diabetic retinopathy, and it'll produce a score that lets you know if this person should actually needs to go see an ophthalmologist now or not. So you can imagine it decreases the number of referrals that might go to a limited resource such as an ophthalmologist. But this idea of using computers to sort of as a first screening pass for what humans might do it provides this opportunity to increase prevention and screening technologies and screening actions. Lastly, now let me spend a little bit of time talking about the community context. So within this context, we've produced tools to help governments as well as community groups better understand the health of their population. Let me dive into a couple of these examples. You know, during the pandemic, we invested in helping public health officials combat COVID-19 with a couple of different things, and two of them are shown here. One is the aggregate mobility reports, and the other is a symptom search trend. You know, one of the interesting things that we were able to do is that when people come to Google, they actually begin to search for different symptoms associated with COVID-19. And we're able to actually track those symptoms and understand what those symptoms are. So we see here from 2018 to 2022 are the searches for anxiety. And you can see this trend from 18 and 22, where anxiety seems to be increasing across the population. There's a dip in late 22 or early in January 2022, and then an increase. This somewhat aligns with sort of the various surges, but an interesting trend nonetheless to sort of help understand the health of a population. And these data actually are from Singapore. specifically. So it's not global data, but specific to Singapore, what we were seeing within the context of the communities within Singapore. But think about the ability to gather this information and better understand at a community level what's happening, or what individuals and consumers or populations within Singapore are concerned about. The second type of thing that we did was we actually produced these reports called community mobility reports. And what they are is during the peak of the pandemic, many organizations and many countries and many governments were putting in place stay-at-home orders. And what those stay-at-home orders said were, hey, for the following days or weeks, to limit the spread of COVID, everyone should stay at home. But what governments actually frequently had a hard time doing was understand whether people were moving or not. So it turns out that some of the signals or some of the information that we use at Gather at Google could actually help governments understand this. As an example, you've all probably looked up a restaurant on Google before, where you're able to see the restaurant and you're able to see sort of a trend of whether the restaurant was busy or not. It turns out you can use that same data to understand if people are moving in the community. You can index it on whether people are staying at home, whether they're at transit stations, whether they're at parks, whether they're going to the office, or whether they're doing other activities. And so we were able to show that when stay-at-home orders were in place, most people stayed at home, and there was this gradual movement to spending more time in transit centers and offices as the pandemic waned. Whereas also we were able to see that early on, people spent more time in parks outside and less time, and that seemed to wane as the pandemic went on. But this ability to use a novel signal to understand community health, whether it be with mobility data or with aggregated search data, was critically important to helping us understand the pandemic better, and is actually a really interesting tool to understand the health of a population. And we do this all with privacy-preserving tools in such a way that no individual will ever be identified, but we look at these data as an aggregate, so individuals can be anonymized. So in addition to sort of those two tools, one of the other interesting tools we developed that manage population health was exposure notification. Many of you all know about this, but this is a collaboration between Google and Apple, where Bluetooth technology was able to tell you if you were in contact with an individual who actually had COVID previously. And if you were exposed, you'd receive a notification via Google, and the state would receive a notification, or local municipality would receive a notification. But the point here is that, again, using data where people live, work, learn, and play in the real life is critically important. And using novel data to actually improve the health of population is something that Google was exploring and thinking about quite a bit. Lastly, I'd like to just highlight this bit about sort of thinking about the social determinants of health and health inequalities. I think it's fair to say, and we probably all agree, that when you think about health outcomes, only a proportion, probably less than 25%, is driven by the clinical healthcare delivery system. The vast majority of health outcomes are actually driven by sort of the environment in which you live, whether it be the social determinants of health, or whether it be environmental conditions or genetic conditions or other things. But this being said, we believe that addressing some of these social determinants is critical to improving health and thinking about health equity. And we've done this across our various products, whether those products be searching maps, really thinking about making information more accessible to places like food pantries or others suffering food insecurity. Really working with partners such as in YouTube, who are from these disadvantaged groups or historically disadvantaged groups. When you think about Fitbit, one of the things that is critically important to us is that when we test a new feature on Fitbit, we make it a point to actually get recruit a group of individuals or users who are diverse, so that the results are representative. And within Google Cloud, within the context of the US, we're really focused on Black maternal mortality. So focusing on a social determinants of health and advancing health equity is critical with Google. And as you think about, the context may be different in Singapore or other parts of the world, but making sure you understand and design for those marginalized populations is critically important. Lastly, just in wrapping up, when you think about Google, our goal is to build a more helpful Google for everyone. And when you think about our founder's letter and sort of where this come from. It's not just the health team. It's not just Vaughn. It's not Karen DeSalvo, our chief health officer. It's at the core of the company. A quote from Sundar can be read here, which is, when we say helpful, we mean giving you the tools and increase your knowledge, success, health, and happiness. So health is a critical aspect of how we are thinking about improving the lives of billions of people. And with that, I'll turn it back over to the moderators.